In this week's episode, we're thrilled to be joined by Lord James Bethell, champion for health at the House of Lords and a passionate campaigner for better health for the nation.
Lord Bethell was the Minister for Innovation in the Department of Health and Social Care during the pandemic and on the front line in the fight against COVID, an experience that made him even more determined to champion health for all.
In this fascinating interview, we talked to James about the current obesity epidemic, the steps that are being taken and need to be taken, and his own passion for wild swimming. Hi, I'm James Davis.
And I'm Claire Davis.
We're the Midlife Mentors, here to lift the lid on how to achieve health and happiness.
The balanced, no-nonsense way.
Hello and welcome to another episode of the Midlife Mentors with me, James.
And me, Claire. How are you all?
Well, we are joined today by a very special guest. More about him in a second.
We're very excited.
Just to update you, we've got our Optimising Hormone Health and Metabolism course coming next week. If you haven't signed up for it, or actually by the time this comes out, you'll have a couple of days to sign up for it. So get signed up for that.
I'll put the link in the show notes as always. So make sure you sign up for that. We've got hundreds of people on that already. So you'll be with lots of lovely people.
And as for us, we're just still recovering from 4 days of Jubilee celebrations, I think. What a fantastic event that was.
It makes us sound like we went absolutely crazy, which we didn't at all. We did go and see the Killers on Saturday night.
We did.
That was probably the craziest thing we've done in years, staying awake, going out past 7:30 at night, which was, I did actually say on Facebook, this is actual footage of James and I going out after 7 o'clock at night.
Very rare event. But the Jubilee was fantastic. We were lucky enough to go up Primrose Hill, see the fly pass, which is amazing, and go down into town and get involved in all the celebrations. So,
it was fab. But I'm very confused. It was a Thursday, Friday, Saturday and Sunday. I still felt like I should have had yesterday, which was Monday. I felt like I should have Monday off.
I feel like a lot of people did take it.
I certainly didn't. I was rammed.
Anyway, without further ado, let's introduce our guest. So we're really privileged. We speak to a lot of guests on here, but it's not often we get to speak to someone that's been involved in government and is actually a champion for health in the House of Lords. So we have with us today Lord James Bethell from the House of Lords. James, welcome.
Welcome.
James, Claire, really pleased to be here.
Thank you so much.
Would you like to maybe just introduce yourself and talk a little bit about your role in the House of Lords and what you have done in government and what you're doing at the moment?
Absolutely. So I've been in the House of Lords for 5 years, and I was a whip for the Department for Health for some time. And then when the pandemic hit, I became Minister for Innovation in the Department for Health. So the pandemic kind of landed on my desk. Now, lots of people were involved in fighting it, but I was very much on the front line of the battle against COVID for nearly 2 years. And it gave me a real insight into the health of the nation. And we'll talk about this a bit more. But what I realised is that we really are not a very healthy nation at the moment, and we need to do a lot more to address that.
Yeah, I mean, I think you've hit the nail on the head there. We talk a lot about, we see the various statistics come out and reports, and it's actually shocking. I think the current stats, something like 67% of adults in the UK are obese or overweight, which is shocking. And we know the figures for children are growing. But I saw you actually posted what's inspired this podcast. You posted today some research from Cancer Research UK that basically stated by 2030, obese adults will outstrip. What was it?
Yes, there'll be more obese adults than non-obese adults. And shockingly, obesity is the biggest single cause of cancer now. The pressure that is put on your body, on your heart, on your organs, on the inflammation in your body from carrying that extra weight encourages the cancerous cells and creates more cancer in our population than smoking or any other single cause. It's a really dire state of affairs.
That's really shocking. And of course, it's quite, I guess, in lifespans, quite a recent phenomenon. We've really seen obesity I think, accelerate. If we go back 100 years, obesity was actually quite rare incidence in the population.
Yes, absolutely. In the Second World War, when we recruited all the Tommies, they arrived at the recruitment centres undernourished. And when they went up against big strapping Germans, they needed to be given several weeks worth of good food in order to get them into shape. But now it's a problem right across the developing world. We were at the G7 Health Summit in Oxford last year, and it became apparent that all health ministers are struggling with the same problem, that we're so prosperous and we've become so addicted to junk food that our weight is really out of control.
Yeah. And just one of the questions that you probably do get asked quite a lot potentially, but how much is obesity and obesity related illnesses, how much are they costing the country at the moment?
That's a really good question, Claire. I can't give you a snappy figure.
No.
But if we were able to deal with obesity alone, it would massively reduce heart attacks, the comorbidities associated with overweight, cancer being the most important. We wouldn't need to build all the new hospitals that we've committed to if we could deal with some of these basic causes of ill health.
Wow. I mean, and let's not forget, for the vast majority of the population, obesity is something that is avoidable and preventable.
And what breaks my heart is that the biggest impact is it reduces the length of people's lives. So the longevity gains that we were having for years and years from cancer drugs and from being able to deal with heart attacks have now completely tapered off. And so longevity has leveled off. And for many demographics, particularly basically poorer demographics, the bottom 40%, longevity is now going down. So people are living, poorer people in the UK are living less than they used to. And they are having more years at the end of their lives where they are basically unhealthy. And what we all aspire for is a long life where we have some healthy years at the end of it to really enjoy. What things like obesity are taking away from us is that nice, healthy tail end to our lives. And instead, too many people are really struggling with illness instead.
I know, it is really shocking. It's really stark when you put it like that. For the first time in living memory, we've had a longer life expectancy. Every succeeding generation has had a longer life expectancy, but now that's going the other way and coming down, which is just shocking. When you think about, on the flip side of that, the advances in medical science, all the rest of it, but yet the life expectancy for certain groups of people is coming down. Do you think that's due to just like the easy abundance of junk food and people just seeing it as like an easy option now to buy? And what's something the government could be taking to help with this? Yeah,
so I think that it is complex, and I don't like to point my finger at one thing, and to an extent, people are responsible for their own decisions. But we have to be aware that there are massive industries, junk food industries, that are selling this food in a very competitive environment. They know that the fats and the sugars and the salts are really appealing to our bodies. We were really designed for infrequent eating. And if we are presented with too much, particularly of the fats and the salts and the sugars, we will simply overeat. And we have a food environment now where addictive foods are put in front of us so often that it's extremely difficult to turn them down. And quite a lot of people in this country are hooked on the kick that you get from the fat and the sugar. And we've all had it. I mean, this isn't voodoo health. This is absolutely basic human psychology. And it's very, very difficult to get off it. And particularly if people have got a lot of pressure in their life, if they've got mental health pressures, that nice kicker that you get from a big burger or a nice juicy pizza can be something that becomes something that you really yearn, and people find it difficult to get off. The targeting of children is something that is particularly bad. We have a very high incidence of obesity amongst kids. I know from my own kids that they get adverts from Deliveroo and Nando's from 4 o'clock, the moment they come out of school.
Yes.
The notifications on their phone are bang, bang, bang. and 10 o'clock at night, and my doorbell goes, and it's the delivery driver dropping off Five Guys for my 15-year-old. I mean, it's kind of like totally mental. I can tell you, there's no shortage of healthy food in our fridge. So I think we have to be honest with ourselves about the nature of food addiction and the nature of the mental pressures on us in modern life. We have to be honest with ourselves about the food environment we've created for ourselves that puts temptation and quite often lack of choice in front of people. But also there's a positive, which is I think we should also try to encourage people to take more exercise and to address the pressures that they have in their life through healthy mental exercises of the kind that I know you two advocate through the programs you do.
I think it is so difficult, isn't it? Because you've just mentioned there's something which is so common, we see such a lot. It's that vicious cycle, isn't it? I think once you get that addiction to the sugar and the fat, and you get that dopamine hit, and you're feeling low, like you said, you're feeling low. But what people don't realise, if they could actually remove that addiction, the sugar, the fat, their gut health would improve, their emotional response to the stressors would then improve. But actually what's happening is they're keeping themselves locked into this negative cycle of feeling low, going for the quick fix, and then feeling low again, because it just stays in that repetitive cycle. Until you break it, we can't understand that the emotions that we're feeling are led by our food as well.
Okay, you put it really well. During the pandemic, at 8:30 every morning, I sat in a meeting where we discussed people who had acute COVID symptoms and were coming into the ICU units. And when you asked about this phenomenon to the nurses and to the doctors on the front line, they said a huge proportion of these people are basically overweight, and they're arriving because their bodies are so out of shape, they can't fight the disease as effectively as people who aren't carrying the same weight. And that led me to why does Britain have so many people who are overweight? And I think you're right. It is partly the food environment, and it is partly the addiction for food, but it is also that mental pressure that a lot of people feel in this country that somehow leads people to making decisions about what they eat that are not smart or clever for their long-term health. And that the mental health causes of food addiction and therefore ill health were really put in front of me very, very vividly during the pandemic.
Wow. I mean, that's a fascinating insight there into the front line and what you were seeing. And indeed, the impact of being obese during the pandemic, because that was kind of talked about and was floated around, but was never really made a main news story.
Oh yeah, no, the scientific analysis of that is very clear. There was a lot of concern about age and about race. Actually, by far the biggest correlation was weight. And what the weight does is it means that all of your organs are struggling to tick over. They're already weakened. And COVID is a really nasty little virus. It seeks out weakness. And if your liver or your kidney or your lungs or your heart or your immune system is already struggling, it will really target you. Now, don't get me wrong, there were marathon runners who got very sick, and it wasn't a direct correlation, but it was a very high incidence. And if we want to be resilient as a nation, we need to get in better shape.
Well, it makes sense because we know that obesity across the board is an indicator for lots of serious health conditions. For exactly the reasons you've said, it puts the body under massive stress, massive inflammation. If you are eating that kind of diet, it's like you're missing lots of key nutrients as well. So, that's compromised. Your immune system's compromised already. It's huge. There's a popular fallacy, is what I say, because it is a fallacy. I truly believe this, that eating healthily is more expensive than eating junk food. And I know from experience, I actually think it's a question of time rather than money. People go for junk food because it's fast. You can create really healthy meals really cheaply on a budget.
And quickly.
And quickly. But why do you think this myth in particular persists that junk food is cheaper?
Yeah. So I have a lot of sympathy with this argument, because you're right that the arithmetic is a bag of carrots and some porridge from Safeways is unbelievably cheap. Of course, the ingredients are cheaper than going to Nando's. But I have 4 kids, and if I just did 4 days of looking after my kids on my own, and I did cook every single meal for them. But,
the old carrot porridge wasn't going down well.
Exactly.
Kids,
we had goat curry, and I really went for the cooking. I was exhausted by the end of it. I didn't want to see a pot or a pan after. That was 4 days. So it is relentless. And if you've got 2 parents with 2 kids and 2 jobs, I have a lot of sympathy for the pressures people are under. Also, junk food lasts in the fridge for longer. If you buy fresh food, it has this irritating habit of going off quite quickly. Yeah. It's easier to prepare. And also, I have a 15-year-old. He just needs a lot of calories. And so in real terms, he needs a big steak or something quite big. And what he yearns for is a sort of high calorie diet. So I can give him a nice big bowl of pasta and what have you, but he really does yearn for the big burgers. So, and for a lot of working people, their objective in life is to get quite a lot of calories. So I think it is probably wrong to see this through the lens simply of cost. Because of course, it doesn't quite work like that. It is a mixture of cost and convenience. And I understand why households lean towards buying junk food and also buying in a lot of food now from delivery. More than half of what we eat is cooked by someone else, and therefore we don't actually know what is in it. And that's why we brought in the calorie labeling to make people aware of quite how bad. I had an ice cream the other day, 2,000 calories for one ice cream.
Wow.
No.
We would love to talk to you.
My jaw's still hanging open, that stat.
Yeah. I think another way of thinking about it is food culture.
Yeah.
What we have to address is not the home economic arithmetic of how much different bits of food. We've got to understand the culture in which people understand why they need to eat, the culture in which people buy food, and the culture in which they cook and prepare food, and to get out of this habit of thinking that pizza is a treat, that ice cream is something that you should have with every meal, that you should feel full and satiated and dopamined up at the end of the meal. Actually, you should feel healthy and restored and not eat between. And I think that's a cultural point that is affordable by all families, but needs a bit of a reset in the way that British people go about it.
I love that. I really love that.
You just mentioned about calories on, you know what I'm going to say, don't you? Yeah. On menus. So calories on menus. Again, there are different points of view around that, and I can see both points of view. However, I found it really interesting. We went out for my mum's 70th birthday, and we went to a restaurant, and it was the first time I'd seen the calories on the menu. And it was really eye-opening and really enlightening. And I have to say, when it came around to dessert, and I looked at dessert, and I'm not a dessert person anyway, and I thought, oh, shall I have a treat? Shall I have a treat? You just said that. Yeah. Shall I have a treat? And I looked at it, and I thought, churros are nearly 2,000 calories.
Yeah, daily allowance
which
in
is
one dessert.
Over, actually, a midlife woman's daily calorie allowance, really. Yeah. They're not exercise. And I thought, I'll probably skip that. Yeah. So actually, it's really interesting because we said to the waitress, she said, what's the behaviour? Because obviously we're really interested in the behavioural differences of people and what they're ordering now. The calories are on the menu. And she said, it's really interesting. People aren't ordering as many desserts. It's the desserts that they're not ordering as many of. So we were thinking, oh, bad for pubs and restaurants. We're good for the south of the nation, but...
Listen, I think that's a good observation. So the objective is not that pubs abandon desserts.
No.
The objective is that pubs figure out how to make desserts that are nice, but not 2,000 calories.
Yes.
So what the objective is that we will see the 400 calorie dessert.
Yes.
Yeah. And that menu, when you go in a year's time, will be full of interesting, I don't know, fruit salads and different ways
I
of
love
doing
that.
things, not dipping deep fried donut into chocolate pots.
Exactly.
What a wonderful
idea. Clearly not.
I also think it is empowering people, because if you see that, you can then make an informed choice, can't you? Whereas I think what happens a lot of time is people just don't know, right? They're like, oh yeah, what, a deep fried pasty? How bad could that be?
I predict that spaghetti carbonara is going to be is on the way out.
But I also we've been saying this for years, salads. Again, salads. People go for salads, they don't go for the protein or, you know, the fish, and to actually take the chips out of it and have salads and things like that. They'll go for the Caesar salad, which is loaded with calories and fat. Yeah. And again, having that understanding of what you're eating is really, really empowering. I am going to address the elephant in the room just on that, though. You know, I understand that we've had some people say to us, oh, you know, my daughter, she's really funny around food. She now doesn't want to go out and eat out because the calories are on the menus. So I can see to a degree where people are finding that a bit uncomfortable, but I still agree with what we're doing. No, I think it needs to be done. It needs to be done.
I agree. And it is tricky, that one. We did put in place mandating restaurants should have menus without calories on them. So you can ask for a calorie-free.
Okay. I didn't know that.
So I'm glad I said that. But it's a tricky one. But again, we're in this situation with obesity as it is. Something needs to be done. So I'm not saying it's not the right move. I 100% think it is.
So I think if I was to answer you that point, we need to do much better as a country with those with anorexia, and the services we provide for anorexia are terrible. And trying to get an appointment for specialists takes years, and it's just totally inappropriate. Yeah. What I don't have sympathy for, though, is people who don't believe that calories and healthy eating is something that we should be striving for. And there are a few people who are hiding behind the anorexia issue who basically are against the whole agenda.
Yeah.
Yes.
And they have weaponized the anorexia issue because they basically are calorie deniers. And they think that it's fine. We're all born with the bodies we've got, and if I'm carrying a bit of extra weight, everyone should be okay with that. Well, that is I agree with the emotion at that on an emotional level. I don't agree with it on a medical or physiological level.
No. The medical evidence is very, very clear.
You have just put that so incredibly beautifully. So thank you. And couldn't agree more with what you just said as well. It's the calorie deniers. I think I'm going to use that one day. Yeah. I'm going to steal that one.
So there were plans, restrictions around junk food advertising that got shelved. Do you think we'll see those coming back, or do you know of any initiatives?
Yeah. Well, I think we will see them coming back because we can't afford the health system we've got. We've got massive queues for just about everything at the moment, and we're building and recruiting. And I don't know how big the NHS has got to get before we can actually deal with all the ill health we have in this country. Yeah. So the penny has got to drop at some point that we need to address the root causes. I'm bitterly disappointed that very small step was skipped by the government. I said as much, and there's definitely a real campaign to get those measures back. The thing is that the adverts themselves create an environment, and if you don't change the environment, then everything else you do is pointless. There's no point trying to encourage people to go on park runs or to look at the calories on their menus if they are, as children, bombarded with adverts for food from the moment they get up to the moment they go to bed.
Well, like you were saying, like with your children getting adverts at school finishing time. I mean, that's just shocking. Really.
I'm still shocked. I mean, I'm still shocked by I think it's Deliveroo or Uber Eats or whatever, when they're all in that room and they're all getting different deliveries, and they make it so glamorized. That's the word. I feel like it's glamorized, all of this kind of takeaway junk food. And maybe that's why the children, or the youngsters, the youngsters are so drawn to it, because it's that whole glamorizing.
Yeah, and they also optimize their food to give you the biggest dopamine
It.
Yeah.
and the sources and everything that goes with it. There's some listen, I'm not against private industry, but there are some very cynical, distasteful aspects of the junk food industry that we should be aware of and not disguise.
For sure. James, what else are you currently working on at the moment? What's next for you?
I mean, this is one of my most important agendas. The tricky thing from a political point of view is to try and change people's expectations from the government of the waiting lists being the priority, and instead the health of the nation being the priority. We have been conditioned for quite a long time to understand that the waiting lists at my local hospital are an indicator of whether my health is being provided for or not. Whereas what I really care as a parent and as someone's child is, are my parents get healthy? Are my children going to be healthy? Are they all going to have a long and prosperous life? So the ambition is to change the agenda from being a sort of sickness system to being a healthy system. And that means a huge amount of sort of change in attitude amongst both the medical profession, but also amongst patients, amongst people. And that's why I'm so supportive of what you're doing, because you're playing directly into that agenda.
Thank you.
I love what you say there. Yeah, I think switching from treating symptoms to actually prevention is going to be so powerful. It's going to be a tricky transition to make, but it's amazing the work you're doing in this space. So thank you for the work you are doing there.
It's really empowering. So finally, we know that you're into your fitness and love to run and cold water swim.
Yes.
If you've seen your pictures of you,
we're fans of cold water swimming when we're living in Marbella in Spain. So it's not
that's not cold.
We're slightly wussy. Yeah. So it's not really cold, it's tepid water swimming. But can you tell us about the benefits? I know, we have the cold showers and things like that, and we're really into that. But can you tell us some of the benefits that you feel you get from that healthier lifestyle, the running, the cold water swimming?
Yeah. So I find four big ones. Undoubtedly, the endorphin hit is really strong. And, I don't know if I'm a masochist or what have you, but I found it, you immerse yourself in this freezing water. It stings like mad for a couple of minutes. Then it sort of fades away. And then after a while, you start getting numb and you need to get out. You might be standing in the cold and it's sort of miserable for a moment. But there's a moment about half an hour later where, whoosh, your body, it fills with positivity. I don't know the clinical names of what's going on in but there is some chemical rush there that is fantastic. But also, I find that really good for my mental health. I mean, it's a really strong reset button in the first thing in the morning. And it clears my head. And I just feel calmer and better equipped to deal with the day ahead. I really do. I do like the physicality of it. I like swimming. I'm a really bad swimmer, but I do some running and I do some weights, but the swimming I find is a really good stretching exercise. I really like the people. So, wild swimmers on the whole are hilarious, amusing. They always got some biscuits and some hot chocolate for you, and it's a good cult. There's a difference between wild water swimmers who are hilarious and bobble-hatted, and open water swimmers who are sort of seriously athletic and low fat and
don't want to get those confused.
But between the two of them, they're great fun. And then there's connecting with the natural world, and there is something about connecting with the natural world that is very, very, very powerful. Isabel Hardman wrote a book about it, the Natural Health Service, that I would recommend to you and to your viewers. Whether it's taking your dog for a walk or going for riding or just being in nature itself is just good for us, I think. And the smell of it and it rebases us. Being immersed in nature is even more so. And if you're literally in the water with the actual bird level, you are more immersed in nature than almost any other experience. So those are the four things that I really get out of it. And I predict it's going to get bigger and bigger. And that's I'm the vice chairman of the swimming APPG in Parliament. vice chairman, open brackets, wild swimming.
I love that.
Brilliant. I love that.
That's amazing. I love, we live near Hampstead Heath, so
we need to go in. You've inspired me to go into the pond
he
now.
really has inspired me to go into the ponds as well.
You should, and that is one of the loveliest.
Yeah.
Yes, and
there's no excuse, they're just minutes away from us.
But nature, you know, we always say about the Japanese call it forest bathing, don't they? Where it actually brings down our level of cortisol. They've measured the levels of cortisol when you go into the forest and how it feels. Natural stress reliever. So wonderful.
Well, James, thank you so much, and thank you for all the wonderful work you're doing on health.
Truly, thank you for all the.
It's been amazing that you could spare this time for us. So thank you, really appreciate it.
Lovely, and thank you for your work. I think I'm a big follower of Midlife Mentors. I think what you're doing is a real inspiration, so keep going. Thank you very much indeed.
Oh, thank you so much.
Okay, take care, bye-bye.
Thanks, bye.
Yeah.
You've been listening to the Midlife Mentors with Claire and James Davis.
We'd love to hear from you, so drop us a line at info@themidlifementors.com with any questions or topic suggestions.
And make sure you join us on our Facebook page and YouTube channel. You can find us under the Midlife Mentors.
Yeah.